Hi, this is Helen Kelly. I work for DMA, which is the consultant for the Pennsylvania CoC collaborative applicant. And this module was made specifically for housing authorities who are interested in potentially implementing a move-on strategy. Okay, first up, we're going to talk about some moving on basics. And I will mention that there is also a general overview module as well. But this particular one for the PHAs, it covers a lot of the same material, but just does a bit of a deeper dive on some of the content which housing authorities might not be as familiar with if they're not currently working actively in the CoC. So right off the bat, we're going to talk about permanent supportive housing because this is the type of housing program most likely that an individual will be transitioning out of with the move-on strategy. There is a potential that someone can move on from rapid rehousing as well, but generally speaking, we foresee that most of the individuals will be coming from permanent supportive housing, also known as PSH. And this is housing which can be site-based or tenant-based without a designated length of stay. So it's non-time limited, and it's paired with supportive services to assist individuals or families experiencing homelessness achieve housing stability. PSH requires that at least one member of the household has a disability. And also in the Eastern Pennsylvania CoC, generally speaking, the household is also considered chronic according to HUD definition. So that it's an added eligibility criteria that one needs to have when going into PSH. Please note that PSH is not a shelter or transitional housing program. Tenants have a lease in their name, and they typically pay about 30% of their income toward rent. Okay, as I mentioned above, PSH can be site-based in like a congregate setting or tenant-based, so a scattered site model. And operating services expenses can be covered by a variety of sources, including but not limited to the CoC program, HOPWA, and state and local funds. All right. Okay, and we're going to be taking a look at the role of housing authorities or housing operators in moving on initiatives. Now, based on some research, here are some ways that moving on can be in alignment with PHA goals. First of all, moving on programs employ screening processes to ensure that only really some of the more stable tenants with a history of paying rent and utilities on time are the ones that are referred through a moving on process. Moving on providers can help tenants with applications and producing needed documentation, including income documentation, which can reduce the administrative burden and wait times for PHA staff related to incomplete applications. And then transition and aftercare services are provided to help promote tenant stability and timely recertification. So that is usually part of a move-on strategy as well. Since there can potentially be a moving on preference, there could be some expedited lease-up times for housing choice vouchers. Also, tenants can transition in place, meaning they stay in the same unit where they were receiving the permanent supportive housing assistance, and then just lease up very quickly because they are already in a unit that has passed inspection. Although, granted, the inspection would have to be done again, but it would have already needed to pass to be in PSH. And Tenants looking for a new unit benefit from housing navigation and other supports that can help them secure housing more quickly than unassisted voucher holders, potentially. We understand that the market is really, really tight right now and it's really hard for everyone, but at least those that are coming from PSH either can stay in their own unit or have the added benefit of a housing navigator or caseworker to help them through that navigation piece. In addition, providers can work with landlords to make sure they complete the required paperwork. They might be able to help schedule inspections and help address any issues that come up. So assisting with paperwork on your end for like the PHA side of things, reducing your administrative burden, and then also helping to complete paperwork on the landlord side of things. So all of this can potentially expedite lease up for public housing units, because move-on programs can refer tenants and help them complete all the required applications for those units to help housing authorities quickly fill any vacancies that you may have. Now, according to HUD, housing authorities and other housing providers that might have provided the subsidy or the unit post-PSH have often responded positively to the following aspects of a well-functioning move-on initiative. They have enjoyed the referral of stable participants, application and income determination already being done or assisted by support staff, reducing time between housing choice vouchers being issued and leasing up, especially if transitioning in place, filling public housing units quickly, as already mentioned, and then promoting the tenant stability and recertification for housing authorities. Now, we just want to take a minute and proactively address some stigmas that might be associated with PSH or other COC programs. One thing to note is that individuals leaving PSH have typically demonstrated years of housing stability. As you saw, they would have already been in their own lease and they would have been required to have a stable rent payment history before even being really eligible to be considered to be moved on. Moving on services are available to help tenants with the transition. So other individuals moving into housing, they may not have that support. And moving on tenants are not more likely than other tenants to violate the terms of their lease. If anything, they have had quite a bit of practice in adhering to leases given their involvement with PSH. There are a number of housing destinations for move-on tenants, any number of which could involve the housing authority or some other local housing operator. There's a number of different factors that affect where someone can move after, but one possibility, as already mentioned a few times, is that the tenant remains in their own current housing just with a new subsidy or a voucher, and that would be their transitioning in place option. The tenant could move to private market unit with or without a subsidy or voucher. They can move to a site-based affordable housing such as public housing, multifamily properties, LIHTC properties, or they could even move into their own home, possibly supported by a home ownership program. Now, this is not an exhaustive list, but just to give you an idea of the resources that can be used, we're looking, and this is, to transition someone out of a PSH program, we're looking at housing choice vouchers, mainstream vouchers, LIHTC units, public housing, and then multifamily. Now, a note on housing preferences at the PHA, and this is from a notice from HUD, that a PHA may also have a preference for individuals and families transitioning or moving up from PSH units. These are persons that were previously homeless, prior to entry into the PSH program, but who no longer need that level of supportive services. While these persons would not be considered homeless for reporting purposes on the HUD Form 558, creating such a move-up preference will contribute significantly to the community's overall efforts to end homelessness by freeing up units, PSH units that is, for currently homeless families and individuals with disabilities who need housing combined with services. So if you don't have these types of preferences, or you are at least open to thinking about it, or you've thought about it in the past but need a refresher, there are preferences out there that can do exactly what the following slide just described. There could be a limited preference for a move-on program with referrals coming through pre-designated providers or agencies, likely whomever is administering PSH in your community, which could be one or more agencies. You could include moving on as a priority group under a broader homeless preference. And then again, this note on reporting purposes that we also mentioned on the slide before. And then also creating a conversion preference for tenants in certain types of housing, such as CoC funded PSH. So this is all allowable per HUD. Now, while DMA is not the expert on establishing preferences, HUD has put out a good amount of material for housing authorities that are looking to do so. So as you can see that if these preferences are established, public comment requirements do apply. But you can collaborate with the CoC, community providers, and other local stakeholders to identify target groups. Also, DMA, the firm that I work for, is happy to help identify some of those, and our email is on the last slide. You're going to have to write or amend the annual administrative plan for the purpose of the preference to identify the intended set-aside population, eligibility, and the number or percentage of vouchers or units the preference applies to. And you are going to want to jointly prepare the referral process with the PSH provider or providers. So even without a preference, or with just admission policies in general can be looked at. And pretty recently, within the guidance that HUD released on the emergency housing vouchers, or EHVs, if you've heard of those, there was language about how CoC funded providers and any other homeless referral source should be intentionally considering the criteria that they're using in order to generate a moving on referral, because basically there may have also been using criteria that is more favorable to certain populations. And right here we have an example of that, where there could be potentially admissions criteria at the PHA level that discriminates against people with criminal justice histories. And then in turn, that could potentially perpetuate racial inequality. So PHAs should consider implementing only those requirements that are mandated by statute. For more information, here are some resources available to you. And then there's other resources as well, as you'll see throughout this module. And then there's also a module specifically for resources where we have some references hyperlinked for you. All right, so that was kind of like what's in it for you as a housing authority, how you might be able to operationalize some preferences, why moving on is, good for the community as a whole, all of those sorts of things. So now we're gonna transition and look at building and formalizing the partnerships with key stakeholders within a move-on strategy. So first up, in terms of like a key stakeholder and partner, is the COC, a continuum of care. So it is a funding source, but it's also a local body responsible for coordinating efforts to end homelessness. And in the Eastern PA COC, that's actually, it covers 33 counties. So depending on like the size or the geographic coverage area of your move on strategy, you will likely have less coordination specifically with the COC than with some other more localized bodies that are, really more at the local level. But the COC is very much at work in the background. They are the ones that were responsible for hiring us to put this presentation together, for example, and they're available essentially through us and DMA to provide technical assistance throughout the process. So the COC is definitely a player. You just may not have as much direct access or coordinating with them due to the COC covering such a large area. And the nature of the role of the COC is to convene partners and leading the moving on initiative design, implementation, and monitoring, which is what we've done here with these series of modules with the different templates that are provided. So the Move On initiative as a whole has been designed. There, as a whole, have been guidance for implementation and different things to be looking at in terms of monitoring. But now it's going to then be up to the real local partners, likely at the county level, to really take those concepts and run with them and make them your own. Okay, and here is a visual of the Eastern PA COC. You'll see all 33 counties. They are divided into 5 RABs, and so each RAB has its own geographic area. The smallest geographic area, but highly concentrated with people, is the Lehigh Valley RAB, and then you'll see that others, such as Central Valley, South Central, Northern Tier, really take up quite a bit of geographic area and quite a good number of counties as well. So depending on the size, again, of the move on strategy and the coverage area, you might be interacting perhaps at the RAB level of the COC, especially if it's something over in the Lehigh Valley, which Allentown actually already has a system somewhat in place similar to this for the EHVs. All right, so again, local implementation and your involvement with the COC itself or RAB is really just going to depend on how broad of a reach your move on strategy is with the PSH providers. All right, so way back in the beginning, we talked about PSH, and typically that these are the partners that you, as housing authorities or other housing operators, will work most closely with in the implementation of moving on. PSH case managers and other staff, perhaps housing navigators, help move on participants complete applications for housing choice vouchers or other housing, help them search for housing if needed, if they're not transitioning in place, negotiate with landlords, really help them prepare for the transition and settle into their new living situation. PSH providers are also going to offer to complete a particular curriculum with everyone who's moving on. It's called the PREP curriculum. It's offered by the Self-Determination Housing of Pennsylvania, and it really teaches folks how to be a good tenant and a good neighbor. So the expectation is that this is going to be offered to everyone who is moving on. And it's housing authorities and other housing operators should really work to build strong relationships with these providers and develop plans for cross-training of staff, and vice versa. The housing providers should be working to build, strong relationships with you as the housing authority and as housing operators. So we've touched on some of these, but the role of the housing authority, it really will depend on which stage of implementation that you're in. But for the design and launch, one thing would be to take a look at those resources and take necessary steps to make them available. So does that mean amending the admin plan? And we talked about that a couple of slides ago. Provide input as appropriate on the development of the assessment and screening process for move-on participants. Right now, we have 2 assessments that the housing providers will be choosing from, but there is no expectation that those remain the 2 assessments as is forever and ever and ever. If they were to change, there would need to be a larger conversation with the COC, just so that they could, remain consistent across move-on implementations. But if you see a need to have something addressed that's not addressed there, or something that might work better from the PHA perspective, that's feedback that is very, very valuable. And we would want you to have those conversations with the local PSH providers. You will have a role in agreeing on the key roles and responsibilities of the housing authority, yourselves as the housing operator, and other stakeholders. And these responsibilities will be formalized through an MOU as appropriate. We have a template for that MOU already available to you, but there might be other things that need addressing that are more nuanced for your area. And you're going to want to identify key points of contact for the PSH providers. For the COC, likely it will be your RAB co-chair, will likely be that point of contact. Potentially someone that's a regional manager for the coordinated entry system. It really is going to depend on the local implementation of what makes sense for your area. And then other relevant stakeholders, and establish a workflow for implementation. DMA, the firm I work for, can assist with this type of identification. There's our email. We also have it on our last slide here as well. Okay, when we're looking at kind of delineating the roles of the key partners, the COC or other coordinating entity, so this might be another coordinated entity at the more local level, but they would be typically responsible for training, interagency coordination, certifying tenant eligibility for moving on. That also could potentially end up with the PSH provider. Again, that just kind of depends on what makes sense in your implementation region. Outcomes and reporting and data tracking, typically through HMIS. The PSH provider they will provide support and, with the documentation and housing applications, housing search and support, landlord engagement, if not transitioning in place, and providing all of those transition supports and aftercare to promote stabilization and housing voucher retention. They may be providing this themselves, or they would coordinate with another entity to provide those services. It's important to note as well that if someone is coming from a COC funded unit, there is the potential for services to continue for about 6 months after the permanent supportive housing rental assistance ends. So just because the rental assistance ends doesn't mean that the person needs to be immediately exited from that program. They can kind of be dually enrolled, remaining in PSH for several months, having those supportive services funded by the COC, and then receiving another type of subsidy. Okay, and then the PSH provider also would have some data tracking responsibilities within HMIS as well. Now, a couple of months ago, HUD provided an entire learning series on moving on, most of which is what DMA used to create these training modules. And in that training that HUD provided, they provided a PHA case study that was doing Move On, was happy doing Move On, and was doing it well. So we're going to take a look at that. Okay, let's take a look.
Great, hello. So once again, I'm Ms. Lebeau, the Acting Deputy Director of the Housing Choice Voucher Program at HANO. Janice and I have been working together for quite a while, and she has been quite the resource for this. I think without CSH, we would not have this preference that we do right now. It's been a huge help both for HANO and our COC Unity of Greater New Orleans. Sorry, let me find my arrows. I told them, there we go, sorry y'all. I told them I knew how to use WebEx, but apparently I didn't. So the Housing Authority of New Orleans, our preference has been around since July of 2020. We did work obviously a little while with CSH and our local COC to craft this preference. The reason that we really wanted to focus on it are the obvious reasons for moving on, right? So for the COC, creating pathways to independence. And by allowing families who have been living in CSH units for years, who didn't have a way to move on, no longer needed the supportive services, but didn't have a way on to move on with affordable housing, creating a pathway to vouchers, to our Housing Choice Voucher Program. And in doing so, having those families move on, that we would free up, obviously, the PSH units for other families who needed them. Our preference does include rapid rehousing as well, but PSH from the beginning has really been a focus. And while we started these conversations with Unity, with the COC, HANO really started to realize the benefits of creating a moving on preference, not only for delivering services in a meaningful way to individuals and households in need, but also benefiting the agency. We have a rather large agency. We have about 18,000 vouchers. And we have about 900 turnover vouchers a year. So we had vouchers available, we were working our waiting list, we continue to work our waiting list, but we were realizing that this would be a great way, not only, like I said, to deliver services in a more streamlined way to families in need, but to actually get vouchers out on the street, hopefully a little bit faster for us, so that we could help our utilization rate as well. So it really was a win-win partnership for both of us, and will continue to be for years, hopefully. So for our moving on preference with the COC, we have had we're really lucky to have a long established relationship with our local COC. We've had a number of limited local preferences for homeless individuals and families. So the COC already knew our whole process for eligibility, or what documentation was needed in terms of verification forms, in terms of HANO's application and other release forms. So we weren't reinventing the wheel. We were really lucky with that. We were just basically able to craft the preference language with CSH and Unity, with the COC, and go ahead and implement the process we already had in place from other limited local preferences. There are previous preferences with the COC too. There were other funding sources involved. So Unity had really had to, with our assistance of course, learn our process and learn what a complete eligibility packet was so that we could efficiently determine eligibility and get vouchers on the street, and so that they didn't lose that limited funding source that they had partnered with the vouchers. Initially for this moving on preference, our focus was really individuals who had been long ready to move on from CSH units. But as the global pandemic hit, we kind of realized there was a new importance to the moving on piece. We had created a partnership with Unity as well, COC, and the City of New Orleans to address individuals who had been formerly homeless, who were living in encampments as COVID-19 was really starting to hit New Orleans in March, early April of last year. The City of New Orleans, along with the state, had been able to secure funding to do emergency sheltering in hotels to break up that communal setting and hopefully slow down the spread. But it was, quickly recognized that that wasn't a long-term solution. So we created another limited local preference to actually move those families from the hotels into housing choice vouchers. But as Unity was working, as the COC was working with those individuals, it quickly became clear that some of these individuals had been chronically homeless and weren't ready to go straight from a hotel into finding a unit with the housing choice voucher, the rules and regulations of the program and all those responsibilities. So it became even more important to look at the moving on, to be able to assess individuals who were already in PSH and rapid rehousing units, and to be able to utilize the HCVP vouchers for moving on to free up those units and move some of the individuals who were in hotels who weren't quite ready for that independent housing into those now available PSH units. And our process for creating the moving on preference. Like I said, we worked a lot with Janice. It was really helpful. I would say the main sources of TA assistance that we needed were work with right-sizing the preference. So that would be both for Unity, for the COC, figuring out what the true needs were of their PSH population, not only individuals who were immediately ready to move on, but who might, a year from now be ready to transition from those supportive services into a straight housing choice voucher. And then for handout 2, I saw one of the concerns was addressing the waiting list, right? So we wanted to make sure that we were having a meaningful impact on the permanent supportive housing program and bringing up those units, as individuals were ready, but also making sure that we were addressing families that were already on our waiting list. So, we had to make sure that the preference wasn't too big in a way that would prevent us from issuing vouchers to other families on the waiting list. So it really helped to just be able to have that discussion, in partnership with CSH to make sure that we were creating something that worked for both agencies. The other part of the TA that was really helpful for me was eliminating concerns over the challenge of working with our current waiting list. Our current waiting list, we opened back in 2016 for the Housing Choice Voucher Program. It was open for a week, and we had 24,000 applicants who applied. So I had concerns not only about how do we open the waiting list to the public in a way that doesn't create false hope or very specific local limited preference. How do we open it to just those individuals who would actually qualify for moving on? And then how do we make sure that we're actually completing outreach to everyone who's already on the list in a meaningful way that doesn't deny someone who's number 12,000 who might be in a PSH unit because we're going to receive direct referrals from Unity. So CSH was able to help us realize that because the COC is already working with the PSH program, that basically outreach to the COC for opening the waiting list meant outreach to any PSH participant within our locality. So even if someone was already on the waiting list, we wouldn't be missing them because the COC would already be working with them, or one of their partners would be working with them. So that was really important for us to get past that hurdle. And then I'll talk about how we open the waiting list too to make it more manageable. But that really allowed us to just focus on crafting the language for the preference. Once we had that set, we did have to update our administrative plan because it was a change to our admission procedures. It required the full public process. It fit our definition of a substantial deviation from the plan. So that added definitely a little bit of time just to make sure that we were, providing proper notice to the public, to our resident advisory board, allowing people time to comment and, be a part of formulating this policy. Ultimately, though, during that time frame, because the pandemic was hitting, the HUD waivers happened to come out at the same time, the HUD COVID-19 waivers. So we actually were able to use that modified public hearing process, as well as modified, changing of the plan, the administrative plan, and then following up with the board. So that sped it up a little bit for us. And I would just say, if there are any housing authorities out there who are thinking about adding this preference, I would really recommend trying to do so before the HUD waivers expire on June 30th of 2021, just because it means that you can actually get that policy in place a little bit sooner, and that you can get those vouchers out onto the street a little bit faster as well. All right, and then once we had it crafted, now that we know how that happened, I want to talk about how it actually worked. So what we decided was the right size for our program would be for 130 individuals and families, preference for 130 vouchers. We did open our waiting list only to applicants referred by the COC. So we did notify the public, via our website that the waiting list was opening. But instead of using our normal web application process and opening it up for anyone who has access to be able to apply, we actually only take applications with a referral from the COC. So we didn't have to open the list for public application. We just get a referral and pre-application in, and we can add the individual to the waiting list and then pull them to the top because of the local limited preference. I will say, to talk about the release of information, we did decide to create a referral form that also had a release of information and a pre-application, because in the past we had run into issues of not having releases on file and kind of hitting roadblocks of knowing what documentation we needed, but not being able to get into specifics with the COC staff. So we wanted to eliminate that hurdle by having that all in one form. We can't get a referral without the applicant agreeing that we can talk directly to the COC. So that's been really helpful. So the COC screens and assesses families for readiness to move on. At the same time, because they're already well-versed in our eligibility procedures, they actually help the family fill out all the forms that TANO needs. They assemble verification documentation, birth certificates, social security cards, all of that. And a complete packet is submitted to TANO, along with the application, referral, and release of information form. Once we get that, we are able to add the individual to our waiting list, determine eligibility and issue vouchers, or send denials. Luckily, we haven't really had any denials. Our criminal background procedure or policy is pretty, it's not a very high hurdle. So the only automatic denials for criminal background are the HUD required for individuals who have been convicted of producing methamphetamine in public housing or registered lifetime sex offender. Anyone else who their criminal background we actually have an internal police department that runs it, deems higher risk, wouldn't be denied. They have an opportunity to go in front of a panel and actually talk about any extenuating circumstances or any rehabilitation that has been done since the individual was released from jail. So we've had really high success rates with that. We do not deny very many people from due to criminal background. So mainly this would just be for over income, and luckily we haven't run into that yet. So once we issue the vouchers, the COC is assisting in the housing search, which is great. That obviously is a vital component. And then TANO actually expedites the inspection and leasing process. So we do that by housing our moving on vouchers within a special programs department. There's one program manager and one housing specialist who are assigned to moving on vouchers. So those individuals know this is a top priority. We need to make sure that the whole process goes smoothly, from determining eligibility to contract signing and new admission. And then we did actually put in our policy that we have the discretion to renew the preference annually. We definitely intend to, but we wanted some space within our preference and our administrative plan to be able to not renew it if we had some sort of funding challenge in the future. And then the results of the moving on preference. So as I said, we implemented this in July 2020, and to date, we've received 48 referrals. Out of those referrals, we've issued 15 vouchers, and 7 of those families have actually been able to lease up and become participants on the program. We've definitely faced some challenges with the global pandemic. It has been a little bit more difficult for some individuals to obtain documentation if they've lost a social security card. The process to replace that has been a little bit more lengthy. We do try to make sure that the COC is aware of any alternative verifications that could be used, but it just takes a little bit longer now to complete the whole process of gathering all the documentation and forms needed for eligibility. But we're making sure not to deny any families on that. We just continue to work with the COC and communicate with them, and they let us know any challenges that they're facing. We do intend that we will continue to receive referrals throughout the year. The 130, when we crafted that number, the idea was not only for individuals who were ready to move on, at the onset of the preference, but so that we'd have a meaningful pathway throughout the term of this preference. So we didn't intend to get 130 referrals right at the outset, but we anticipate that we'll get more as more families are deemed ready to move on from these services. So that's all I have, Jan. Thank you.
Great, thank you so much. It's so exciting to hear about all the progress that's happening. And yeah, these programs can take time to sort of get started up and moving, and COVID makes all of that more challenging. But I think it's really rolling now, and we'll start to see those numbers going up. So really exciting. So we're going to just move into some times for questions.
So I hope you found that helpful, hearing from another housing authority and how it's actually working right now in another area. So the preference and the partnerships that they have in a nutshell, here it is on one slide. So housing choice vouchers for up to 130 individuals and families. HANO, or the Housing Authority, opened the waiting list only to applicants referred by the COC. The COC screens and assesses families for readiness to move on. The COC sends referrals and completed eligibility packets to HANO. HANO adds the referred households to its housing choice voucher waiting list. HANO determines eligibility and issues vouchers or sends denial letters. The COC assists in housing search if needed, and HANO expedites the leasing process, and then HANO has the discretion to renew the preference annually. So there, that all is in a nutshell. Here is a resource that we just wanted to share. It's not too jargony at all. It's written in plain language. The HUD office came out with this just maybe about 2 years ago, and it's maybe 2 or 3 pages long, so super brief, super plain language, but it does a really good job of explaining what a move-on strategy is. And then lastly, for one more time, here is our email address. If you have any questions or need to be linked with partners in your community, we are the consultants for the Eastern Pennsylvania COC, and we're happy to help. Thanks for watching.